community service outreach. But yeah, Heard for Honduras is one of the big ones that they do.
Do you guys still do, I can't remember what it's called. My roommate was one at one point at the pharmacy school. Like at preview days, they'd go.
Student ambassadors?
Yes.
Yes. Okay. Yeah. We currently have 6. How many did we lose in the spring? Zach and Laura. Yeah. So I think we have 5 or 6 right now. We normally try to keep 8. And so those are paid positions. And those students help us just like your all's ambassadors do. They do the tours. They do preview days. They go out and recruit sometimes. But yeah, they make phone calls. Green and white days. So any on-campus events, they'll come to that. But they're required to get so many hours to get paid. So they're pretty helpful.
Yes. Oh yeah, I'm sure.
Do you know what the success rate is for like passing the boards? Is that what they're called?
Our NAPLACs? Last year was 85%. Hang on. Hold, please. Find out. The first year, so we've graduated 3 classes at this point. The first year was not hot, and I think it scared the...
Yeah, we kind of like it because it scared everybody that followed.
But last year's class did really well. I think, so the way NAPLAC scores are, you get your first time NAPLACs, so that's everybody, their first score. And then I think it's a 3 semester or 3... Isn't an aggregate of 3 times after that, or hang on, I'll tell you. That's nuts. I think it's 80-some%. I think it's 85 too. Yeah, so on-time graduation rate for us is 97%. So we have a really high retention rate. NAPLAC's first-time pass rate was 86%. The composite third trimester pass rate, so that's what I was trying to think of, was 92%. Job placement at the time of graduation was 90%. So that's one selling point to high school students. The average salary nationally for a pharmacist is about $117,000. So in this area, and especially in rural areas, where the need is higher. In southern West Virginia, a lot of pharmacists start in the 130s, 140s.
Does the 90% include students who like go do residency and all that? Okay.
Yeah. So more and more residencies each year. We have some at Cabell Huntington, Marshall Health, but then we have students who apply for them nationally. So I think out of this last class we had like 10 to 12 students who decided to do residencies. Residencies are not required. Students can practice with just their PharmD. But if they're planning on specializing or being in a hospital setting, it's strongly encouraged that they pursue a residency. Those can be 1-year or 2-year residencies. So if a student is wanting to work with kids, like they can do a pediatric pharmacy residency. So it could be a good selling point for your nursing students who are performing well that may not necessarily get into the nursing program. Pharmacy may be a good other route for them that they haven't really thought about. So.
Yeah, they're doing some work.
So what else would you guys like to know? Anything I can help you with?
I know when I tell students about like the whole like group atmosphere, they really like that.
Yeah, I think
It kind
that
of sets it apart from other schools.
it does. When we established that, we were only one of 3 in the nation that were 100% active learning. So other schools will incorporate it into their curriculum, but everything we do is around active learning. We also do interprofessional education, or IPEs, and so that is with other colleges here on campus. So once a semester, our students will get together with medical school students, nursing students, social work, physical therapy, and they'll work together to solve problems. So that gives you kind of a broader look at healthcare as a team.
And you guys also do, I don't know what to properly call it, but like the mock situations where like they go into a room and like they have a patient. They're like
Yeah, simulations.
Yeah.
So we have a couple of different ways we do that. We have simulated patients who are just people from the community who come in and the students work with them. We also have OSCEs, which are their clinical exams where we test those skills. So they'll practice that, and then they'll be required to come in and actually perform those. And so that's part of their progression. If they don't pass their OSCEs, they, don't really progress. So our students also take, which students always want to know, is it similar to medical school where if you take the step 1, like you're behind if you fail it. We have the PCOA, which for P1s and P2s, it's not high stakes. It's just basically a review so that they can see where they are in specific areas. But once they get to P3 year, they have to get a certain score on the PCOA to progress to their ABBYs or their rotations. So that can be a little bit stressful. But we do have remediation. We have ways that they can, review for that. But
Can you talk a little bit about the research they do?
Sure.
I've done a couple.
So students can start research as early as their first semester, P1 year. We have researchers doing all kinds of different things, so depending on what they're interested in. Our research, how many do we have upstairs right now? When we're at a full capacity for faculty upstairs, it's about 12, I think. We just had a few people leave. But yeah, so they work on grants with the students, they do research with the students, and if their research gets published, the students' names are on that. They also get to go present at conferences, so that helps the students build that portfolio. And I would strongly encourage a student, if they're interested in residencies, then they need to do some of that research. So we have a lot of students who are interested in becoming researchers only, and so that's why we're developing that MSPS program.
So now when we were there, they were doing like diabetes stuff,
Yeah, so,
and cancer stuff.
Yeah, a whole host of things. So it just completely depends. And with each new faculty member we get, they bring, a different type of research to us. What's Ham Bookins?
Students will go and present posters on their research.
Yeah.
So, they get all sorts of exposure before they graduate. So it's a good thing.
It's very good for residency placement.
Okay, I'm gonna ramble. I'm so excited about that pharmacy school because, anytime you come into Huntington, there's no, entrance. There's
Right.
those, all of a sudden you just, run into the university. Mm-hmm. This could be so nice, getting off the interstate, big hospital, big pharmacy school. And, I think that, especially in West Virginia, you just, a lot of people don't think of anything. They're like, I need STEM, but then they're like, I'll be a nurse.
Absolutely.
That's, the default setting. So I know whenever I was in high school, I did the HISTA program.
Mm-hmm.
We had to do a symposium every year, and people would come and do they call them our field trips. We stayed there. And they would come and talk to us, and then each year we had to do our own little science project, research throughout the year. Are there is there any way that you all could or I could help set up you all going and helping them think of their projects, because half the time it's let's go test this water, and they do that for 4 years. And then I remember I tested sunblock for 4 months.
Absolutely. So, do you know Austin Riggs?
The name sounds so familiar.
So, Austin Riggs is actually a P2 student who is on our HISTA scholarship. So, we just established the HISTA scholarship in 2017, right? And so we're hoping that we'll be able to fund more of those. But it's a full ride for him.
Yeah.
So he gets all of that.
It's amazing.
And so part of his scholarship is he has to work the symposium every summer, and he has to do outreach with HISTA. But yes, our faculty are open to getting involved. However, I actually just emailed Sabrina a couple days ago because they want to do a scores event. And so anything like that, if you hear of things like that, forward them to us. We're happy to do any kind of community outreach like that.
Because I know, like, just like of like local things. I know every year they have like the summer camp here at the university, and then like I don't know, it's been a minute. They had like the Society of like Black Scholars, and you like come and stay for like a night and do things like that.
Yeah.
I just remember I had to stay at WVU for 3 weeks, and like not my place, but like it made me like think about like different like options like I never even like thought of. And so I feel like a lot of local people decided to go into engineering because the new engineering building popped up. And
I think it'll be great exposure for the pharmacy program. Nobody knows where we are currently. So you all may not know where we are. We're at the VA hospital in West Huntington, so we're not that visible, I feel like. But when the building is downtown,
you're going to be the first thing.
I think it's going to be really good. Now, there's still job growth in pharmacy. Our applications nationally have gone down for a multitude of reasons that our organization is trying to figure out. But there is, especially here in the tri-state area, I know a lot of students come to Marshall, but then they want to go home. You know, and so a PharmD is something that is applicable across the country. So if they want to work in like my hometown, you know, you can go to Man and work, or you know, you can stay local. We've had a lot of students who have been from out of state who have stayed local because of the price of housing. Cost of living is a lot lower than where they're from, and the pay here is really good. So, anything I've left out that they need to know?
Going back to the camps and things that you mentioned, I think anything like that we can get involved in early would be, because kids think a pharmacist stands at Walmart and counts pills.
Yeah.
That's what everybody. So anything we can do to get that early exposure, we're more than willing to do.
I know,
that.
like at least for like the local high schools, because I was like in like the Cabell Lincoln, we were supposed to have someone come and talk to us, like 5 times a year, like someone new, and like we had like organ donor people coming and like talking to us about it, but we never really, and we had a dentist come once, but that was. So it would make like a big, and then like you can cut off a year. I just think that local people are just gonna like, oh, STEM, wow, and I don't have to be a nurse. Like,
well,
so
and I think a lot of that has to do with, you know, what are they exposed to? They're exposed to teachers, they're exposed to nurses, they're exposed to doctors. Like that's what they see. So we, not only as a school of pharmacy, but as a profession, are trying to make pharmacy more visible. So anything that you all see like that you think we may want to do, just let me know.
We've got one organization called Generation RX, and they go out and do presentations to like the middle schools and high schools, talking about drug abuse and things like that. Because of our area, they try to get that message out early about, you know, prevention and all that. So any of those things we can do just to let people know about.
So I have goodies.
Yes.
Anybody wants
She's working
goodies?
the farm's market.
Yeah, that Tumblr is like one of the best Tumblrs. It's as good as a Yeti, I think.
Well,